For teen obesity, Wegovy injection is approved from age 12, while Zepbound is not approved for teenagers. For an eligible teenager, the decision is whether medication is justified. The right patient may gain major health benefits. Poorly selected treatment can create nutrition problems, side effects, and an unhealthy fight over weight. The decision should focus on health, not appearance. Wegovy activates a gut hormone signal called GLP-1. Zepbound activates a second gut hormone signal in addition to GLP-1. Both reduce hunger, make smaller meals satisfying, and slow stomach emptying. The extra signal changes Zepbound, but it remains unapproved for teenagers. Eligibility starts with a growth chart. For teenagers, body mass index is compared with others of the same age and sex. Obesity begins at the 95th percentile, meaning 5 of 100 peers have a higher value. Wegovy injection is approved from age 12. Wegovy tablets are not established for patients under 18. Approval alone does not decide treatment. Growth pattern, obesity severity, health problems, nutrition, and readiness for ongoing care all matter. Treatment should address a medical problem and fit the teenager's care plan. Family support matters too. A 68-week teen obesity trial studied Wegovy with lifestyle support. Average body mass index fell 16.1% with Wegovy versus a 0.6% rise with placebo. That large difference shows a meaningful average benefit. Participants also received coaching on food and activity. Some teenagers lost more than average, while others lost less or stopped treatment. Parents should judge progress using health changes, growth, and side effects, not online comparisons. Adult Zepbound results are not enough for teen approval. It is being studied in teen trials but remains unapproved for this age group. Teen use is off-label, meaning outside approved use, and requires a medical reason and close follow-up. Consider two teenagers asking for the same injection. One has severe obesity, high blood pressure, rising blood sugar, and sleep apnea that interrupts breathing at night. The other has a healthy growth pattern and wants to lose 10 pounds before school. Their medical needs are very different. For the first teenager, untreated obesity can worsen sleep, blood pressure, liver health, joint symptoms, and diabetes risk. Waiting can let those problems progress. For the second, appetite suppression may create more harm than benefit. A prescription should treat disease, not ordinary body dissatisfaction. An evaluation checks the growth curve, weight changes, medicines, sleep, eating patterns, activity, and family history. Blood pressure and blood tests can reveal obesity-related complications. The clinician should ask what the teenager wants. An unwilling teenager is less likely to sustain treatment. Teen agreement does not remove parental responsibility. The teenager should understand injections, expected benefits, common side effects, and ongoing treatment. Use health language instead of shame or public weigh-ins. Honest reporting of nausea, missed meals, or emotional distress makes treatment safer. Treatment may last longer than parents expect. These medicines change appetite signals while taken, and stopping can allow hunger to return. Adult studies show substantial weight regain after stopping Wegovy. Teen stopping data are limited. This is chronic disease treatment, not a short cosmetic course. Weight regain can reflect stronger appetite signals returning, not a character flaw. Families should discuss cost, insurance, supply, and who will manage care into adulthood. If long-term access is uncertain, the plan should address what happens when treatment stops. If treatment proceeds, Wegovy starts low and rises gradually to reduce stomach and bowel reactions. For adolescents, the ongoing dose is 1.7 or 2.4 milligrams weekly, with 2.4 recommended. The 7.2 milligram dose is not established for teen weight loss. A dose increase can be delayed if needed. Stomach problems are common while the dose is increasing. In the Wegovy teen trial, nausea affected 42% and vomiting affected 36%. Stomach side effects were more common with Wegovy than placebo. Families need a hydration plan and should contact the medical team when symptoms become persistent or severe. Reduced appetite can become reduced nutrition. Teenagers still need protein, iron, calcium, vitamins, and enough energy for growth. A teenager who skips breakfast, barely eats lunch, and vomits after dinner is not succeeding because the scale moved. Too little food can reduce muscle and development. Weight is only one treatment result. Better sleep, easier movement, lower blood pressure, improved blood sugar, and healthier liver tests may matter more. A teenager can gain health benefits before reaching an ideal size. Chasing thinness can create pressure to keep increasing treatment. Health gain should outweigh treatment burden. Track growth, blood pressure, blood test results, strength, energy, mood, school function, and side effects. Continue when health improves and the burden remains acceptable. Reassess when daily life becomes worse. Repeated vomiting, faintness, very dark urine, or inability to keep fluids down requires prompt medical attention. Severe constipation with abdominal swelling or persistent pain deserves assessment. The medical team may need to delay the next dose increase, lower the dose, or interrupt treatment. Severe upper abdominal pain reaching the back can signal pancreatitis, meaning inflammation of the pancreas. Upper right abdominal pain, fever, or yellow skin can signal gallbladder disease. Rapid weight loss raises gallstone risk. These symptoms need urgent assessment rather than a routine visit. Wegovy and Zepbound carry the FDA's strongest warning because thyroid C-cell tumors developed in rodents. They should not be used with a personal or family history of medullary thyroid cancer. This also applies to multiple endocrine neoplasia, type 2, an inherited tumor condition. Type 2, diabetes changes monitoring. In teenagers using Wegovy, blood sugar should be checked before and during treatment. Low blood sugar risk rises when Wegovy is combined with insulin or certain diabetes medicines that increase insulin release. Those medicines may need adjustment as weight falls. Pregnancy changes the plan because weight loss treatment is not used during pregnancy. Wegovy should be stopped at least 2 months before a planned pregnancy. Adolescent care should include private counseling when appropriate. Parents need safety information without turning every visit into constant monitoring. Eating disorders require another screening step. Restrictive eating, binging, self-induced vomiting, or intense fear of weight gain needs assessment before appetite suppression begins. Medication can reduce hunger without treating an eating disorder. Weight loss can hide worsening behavior. Mood still deserves attention. In January 2026, the Food and Drug Administration found no increased risk of suicidal thoughts or behavior with these medicines. Teenagers face bullying, depression, anxiety, and body image pressure. Social withdrawal, hopelessness, self-harm talk, or sudden behavior changes require immediate attention. Build a review plan before the first dose. Define which health problems should improve, which side effects are unacceptable, and how growth will be protected. Do not raise the dose only because a higher dose exists. Use an approved ongoing dose that balances benefit and side effects. A strong candidate has obesity with related health problems, willingness to participate, and reliable follow-up. A weak candidate is pushed mainly by appearance pressure, secrecy, or unrealistic speed. The final choice should balance medical need, nutrition, growth, mental health, side effects, family support, and access. Parents should not treat Wegovy and Zepbound as interchangeable teen options. Wegovy injection has evidence and approval for obesity from age 12, while Zepbound does not. Even when medication is appropriate, success means better health without sacrificing nutrition, strength, development, school life, or trust. Medicine, simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.